My name's Mike Sitorius, and I grew up in Nebraska. I went to undergraduate school at Hastings College and followed that on with medical school at the University of Nebraska Medical Center. After that, I did residency training in family medicine at UNMC. I never planned on being in academics. My goal was to go out and emulate my father and be a family physician in rural Nebraska or rural America. But I stuck around for 1 year, and that 1 year is now 31 years. And what I like about it, awesome teaching young people, but I've learned about medicine and the importance of partnering with patients and families in their care. What I like most about family medicine is the opportunity to work with the patients' families, to get to know them not only as patients and their medical problems, but also to get to know how they fit into the context of their jobs and their families. I think it's really important to look at that whole thing that whole context when you're trying to take care of patients and their medical issues. I grew up in rural Nebraska. My dad was a GP. And I probably thought about being a doctor since I was in 4th or 5th grade. When I was growing up, I actually worked in my dad's office after hours by cleaning up and preparing the office for the next day. I just was around medicine. We made house calls with my dad, and I can remember many times sitting on the front porch waiting, not so quietly, for him to finish up what he was doing, but seeing the impact he had on the community and on the patients that he was taking care of. Well, I grew up in Nebraska. I just like the people. Honest, hardworking people, really easy to communicate with, to have a conversation with, and to develop that doctor-patient relationship that I think is really important to quality health care.